Hi, I'm Steve Mills, founder of OnCall Scheduling Solutions. With OnCall, when we initially started it, we really took a look at some of the systems that were out there, and we're really surprised by how antiquated they were. A lot of the hospitals are still using a paper process and filling out their schedules through an Excel file. Nurses are requesting for time off and shift changes through post-it notes and messages to their admin person, and we needed a more effective way to do that. So we developed a product that initially was to get to our nurses so that we could schedule them and get them into the hospitals as quickly as we could. And it evolved over time to becoming a much more effective scheduling tool. So not only does OnCall allow hospitals to do their scheduling, but it also allows them to fill open shifts and last-minute call-outs. With our process, we have our OnCall monitoring system that allows the hospitals to post an open shift. So if someone called in sick or they can't fill in a day that they need, the hospital administrator or the scheduler can post that open shift, and that then gets broadcast to all the nurses in their department through a text messaging process and email that allows them to then try to get people to fill that shift. And through that, a nurse would then get a text message or an email, and then they can respond to that, whether or not they're available for that shift, and fill those shifts automatically, eliminating the need for schedulers to get on the phone, start going through the call list, see who can work, who can't, and that kind of thing.
My name's Tammy Daggett. I'm a registered nurse and a vascular specialist. I've been using the OnCall system for a year. Before using OnCall, I was using a paper schedule system, which was annoying and difficult. It was a pain in the neck. I like being able to broadcast information to other nurses that if I need time off or vacation, I can do that right from my smartphone or my computer, whereas before that was impossible. Requesting a shift or time off would have to be submitted in writing. Now I can submit it to everyone, employees as well as management, through the email system, the text, or my smartphone option through OnCall.
Every nurse gets their own personalized dashboard or space that gives them all of their pertinent information. And that goes back to being part of the functionality of the site that we really wanted. That ability to have the system be easy to use, because everyone's busy nowadays, and the last thing we wanted them to do is make it a complicated procedure so that they weren't able to effectively pick up these shifts. So with OnCall, they can log right in, they see the open shifts, they can apply for the shifts, they can see what shifts they've been accepted for, and the process really becomes a self-filling one, so that for the hospital, they're not spending a lot of time making phone calls and going through their phone list to see who can fill in that shift that night. And for nurses, it gives them a lot of flexibility, because now they can look at an availability, or when they're looking for actual positions, they can log on and see what's available today, tomorrow, next week, next month, and kind of really schedule when they can work and what needs that they need to fill. We have the ability to monitor overtime for our hospitals, so that a hospital, before they award shifts to certain people, they can see if they're going to push them into overtime or not. There's a full reports functions, so that we can pull out coverage reports and time off reports and those kinds of things. And there's a time off request report, so that you can quickly and easily see when people are scheduled for their vacations or their time off and that kind of thing. And we also put in there a calendar view for the nurses, so that they could also see who else was working the shifts that they were working. And this really kind of worked out well, so that if they needed to swap those shifts, as we had mentioned earlier, it's really easy for them to see who's working the days that they're on. So now as a whole, we bring together all these pieces. It's become a really effective product for hospitals. They've seen a great return on it. It more than has paid for a lot of facilities, the cost of the product. And when it comes right down to it, you combine the ease of use of it and the cost savings of not having to implement a whole system yourself. OnCall has been a really effective tool for a lot of our clients.